Welcome. We're doing a deep dive today into something called histrionic personality disorder, HPD.
Right. We've got some source material here, clinical info, research notes.
And the idea is to pull out the key stuff, what you really need to know, without getting totally lost in the weeds.
Exactly. We want to get a clear picture of what HPD is, what might lead to it, how it impacts people, and, what kind of help is out there.
Okay, let's start with the name. Histrionic. It means dramatic, theatrical.
Which is a pretty big clue right off the bat.
Yeah. The sources describe it as a mental health condition, involves really intense, kind of unstable emotions, and a distorted self-image.
And a really strong desire, often to be noticed, which can come out as, well, dramatic behavior.
It's interesting that you said often arise from a deeper yearning, so the outward stuff might seem superficial.
But underneath, yeah, it could be about seeking validation, connection, maybe unconsciously.
And it's not something that just pops up overnight, is it? The info suggests it emerges, what, late teens, early 20s?
Generally by early adulthood, yes, which is why a formal diagnosis usually isn't made before 18.
Makes sense. Personality is still developing then.
Right. So, okay, how does this actually look? What are the key behaviors we're talking about?
Well, the core thing seems to be this excessive emotionality, but it could be kind of shallow.
Yeah.
And using appearance, even sexuality, to get attention.
That attention piece is huge. Our sources mention feeling really uncomfortable, even kind of down or depressed if they're not the center of attention.
Right, not just wanting to be included, but needing that spotlight, feeling underappreciated otherwise.
And this can lead to specific behaviors like those listed in the DSM-5. That's the Diagnostic Manual Mental Health Pros use.
Okay.
So one thing is inappropriate sexually seductive or provocative behavior, and it's often less about actual desire, more about getting that attention fix,
Gotcha. And the emotions. You said they can shift really fast.
Yeah, rapidly shifting. They might seem super intense 1 minute.
Maybe not ring true to others. Like the depth isn't quite there.
Yeah. Exactly. It can come across as insincere, even if that's not the intention. The volume's up, but the substance might feel thin.
And appearance is a big tool in the box, then.
Definitely. Consistently using physical appearance to draw attention. Maybe being overly concerned with looks, clothes, making sure they stand out.
And how they talk.
Often described as impressionistic, vague, lacking detail.
So lots of drama, strong opinions maybe, but light on the facts to back it up.
Pretty much. You might hear self-dramatization, theatricality, exaggerated emotional expression.
Which could be awkward for people around them, I imagine.
It can be, yeah. And they can be quite suggestible.
Meaning easily influenced?
By others or just by circumstances, especially if it seems like a way to get noticed or gain approval.
Okay. And relationships. They might misjudge how close they are to people.
That's another point, considering relationships more intimate than they actually are. Casual acquaintances might feel like close friends in their mind.
That could lead to some tricky situations.
For sure. And then there's this low tolerance for frustration or delayed gratification.
So wanting things now? Easily bored?
And often looking for reassurance, constantly seeking approval, trying to prop up that self-esteem.
Which must make relationships difficult to maintain long term.
It really can, that combination. The shifting emotions, maybe seeming shallow or fake. The neediness, it puts a strain on things.
Plus maybe making rash decisions, looking for excitement.
That can happen too, yeah. Impulsive choices.
And underneath all that drama, you mentioned a fear.
A deep, maybe unconscious fear of being ignored, overlooked. Like the behavior is a defense against that.
Wow, okay. So what leads to this? The causes? We said it's probably a mix.
Right, exact causes are unknown. But it looks like a combination, likely environmental factors and genetic ones.
Genetics. So it might run in families.
There's evidence suggesting that, yeah, a tendency for HPD or maybe related traits to show up across generations points to a possible inherited link, like with other personality disorders.
And the environment part. Early life experiences.
Childhood trauma comes up in the sources. Things like abuse or maybe losing a parent or close family member. Big, impactful events.
That makes sense. And parenting styles could play a role too.
Potentially. Things like inconsistent parenting, maybe overindulgence, or a lack of clear boundaries.
Or if the parents themselves were, like, really dramatic or volatile, or even inappropriately sexual.
That's mentioned too, yes. That kind of modeling could increase the risk.
And all this might feed into low self-esteem.
That's one theory. If those early relationships are difficult, it can make it hard to build a stable sense of self, so they look outside for validation.
There was also something about discipline or lack of it.
Yeah, the idea that if a child learns that being dramatic or acting out works, that it gets them attention, they might keep doing it. It becomes a learned pattern.
So it's complex, no single cause.
Seems that way, a real interplay of factors.
Okay, so how does HPD actually affect someone's day-to-day life? You said they can sometimes function pretty well.
Yeah, it's interesting. Socially, even at work, they might seem fine, even have good people skills on the surface. It's not always obvious.
But the real impact is often felt more personally, in relationships.
Definitely. Maintaining stable, intimate relationships tends to be where the biggest challenges lie. That perceived insincerity or the erratic behavior makes it tough.
And the job situation. You mentioned maybe frequent changes.
That can happen. The need for stimulation, getting bored easily, low frustration tolerance. It can lead to jumping between jobs or maybe taking risks for excitement.
And a really key point seems to be that they often don't see their own behavior as the problem.
Exactly. That lack of insight is a major hurdle. They might genuinely think, I'm just passionate, or I'm just expressive.
So they only seek help when things go wrong because of the HPD, like after a breakup or losing a job.
Often, yes. They might come in for depression or anxiety, which are downstream consequences of the relationship problems or instability the HPD has caused.
Are there other conditions that often go along with HPD?
Yes, there's an increased risk for other things. Depression, anxiety disorders, definitely. Also, substance use disorders, somatic symptom disorder, where psychological stress shows up as physical symptoms, panic attacks, too.
And in extreme cases, that attention-seeking can involve suicidal threats.
Sadly, yes. Sometimes gestures or threats are used as a way to get attention or express distress, which is obviously very serious.
Okay, so if someone suspects HPD, how is it actually diagnosed?
It involves a thorough psychological evaluation. A mental health professional, psychologist, psychiatrist, talks with the person, observes their behavior, appearance, asks about their history and symptoms.
And they're looking for those DSM-5 criteria we mentioned, need to meet a certain number.
At least 5 of them, yes. And because of that potential lack of insight we talked about,
They might talk to family or friends too, get another perspective.
it can be helpful, yeah, to get a fuller picture, with the person's permission, of course.
Right. And treatment, what helps?
The main treatment is psychotherapy, talk therapy,
The goal being.
to help the person understand the why behind their behaviors, those underlying fears and motivations, and to learn healthier ways to relate to people, manage emotions.
Are there specific types of therapy that are good for this?
Several seem helpful. Cognitive behavioral therapy, CBT, is often used.
How does CBT help here?
It works on changing those attention-seeking behaviors and the thought patterns behind them, building coping skills, boosting self-esteem in healthier ways.
Okay, what else?
Psychodynamic therapy can be useful too. That
Yeah.
goes a bit deeper into the psychological roots, exploring past experiences and relationship patterns.
And supportive psychotherapy.
That's more focused on managing symptoms, building self-esteem, improving coping through encouragement and validation.
Group therapy was mentioned too.
Yeah, that can be really powerful. Getting feedback from peers, practicing communication in a safe space, learning how their behavior impacts others directly.
Is medication ever used?
There's no specific medication for HPD itself, but if someone has co-occurring conditions like depression or significant anxiety.
Then meds might help manage those symptoms.
Exactly. Antidepressants, anti-anxiety meds, maybe mood stabilizers in some cases. They treat the associated symptoms, not the core personality disorder.
Okay. Now, shifting gears a bit.
Mm.
What if you're interacting with someone who shows some of these traits? It sounds like it could be challenging.
It certainly can be. You might encounter that theatricality, the drama, maybe unpredictability, the constant need for attention, exaggeration, maybe blaming others when things go wrong.
So how do you handle that constructively?
One strategy mentioned in our sources is the BIFF response.
BIFF. What's that stand for?
Brief, informative, friendly, and firm.
Ah, okay. So keep it short, state the facts, be polite but clear about your boundaries.
That's the idea. Avoid getting sucked into the emotional drama. Don't argue, don't criticize heavily. Just state your position or the facts clearly and firmly, but keep a friendly tone if possible. Set boundaries without escalating things.
That sounds like a useful tool.
Yeah.
Okay, finally, what's the general outlook for someone with HPD?
It really varies. There isn't a cure in the traditional sense because we're talking about ingrained personality patterns.
But people can get better,
Yeah.
lead productive lives.
Absolutely. Many can, especially with therapy. Gaining insight, improving social skills, That makes a big difference.
But for more severe cases,
They might continue to struggle more significantly with work and relationships, yes. Consistency in therapy is often key.
the main takeaway seems to be HPD is a real mental health condition.
Yes. And getting help, ideally earlier rather than later, can really lessen the disruption it causes.
And a big part of recovery or management is building that internal sense of self-worth, right? Not relying so much on external validation.
Precisely. That's a crucial long-term goal.
Okay, so wrapping up this deep dive on histrionic personality disorder, we've looked at that core drive for attention,
The wide range of dramatic behaviors it can involve,
potential contributing factors like genetics and early experiences.
how it impacts life, especially relationships, and the treatment options available.
Understanding these patterns, even just intellectually, can give some really useful perspective, I think.
Definitely. It sheds light on the different ways that basic human need for connection can play out, sometimes in ways that cause distress.
Which leads to our final thought for you listening. Think about that need for connection and validation. How does it show up in your life? How does it affect all of us?
And maybe understanding these more extreme patterns, like in HPD, can help foster a bit more empathy for others, and then maybe even for ourselves.
Yeah, just considering the role attention plays.
Yeah.
Not to pathologize everyday stuff, of course, but just as, food for thought about our own lives and relationships.
A point for reflection.
Thanks for joining us on this deep dive.